Hi everyone, my name is Mariah Graham and I will be presenting to you an article entitled Nature of Conflict in the Care of Pediatric Intensive Care Patients with Prolonged Stay by Studdert. This article identifies the frequency, sources, types, and predictors of conflict dealing with the care of pediatric ICU patients with a prolonged stay. So next I will provide a summary of the article. Conflict in this article was classified as being either team-family, intra-team, or intra-family. The goal was to measure the frequency of various conflicts and capture the perceptions of the clinicians on the sources of the conflicts. In addition, the study identified predictors of those conflicts by using patients without conflict as controls. The method used was in the form of a project entitled Care Improvement for the Critically Ill, or CICI. The project was designed to measure the level of satisfaction with ICU patients, their family members, and caregivers, and test strategies for reducing conflict, specifically in the ICU. Critical care experts from Harvard Medical School determined that long-stay patients are better controls because they are more prone to serious conflicts as a result of their acuity and complicated nature of illness. Conflict was identified by conducting interviews with the attending physician and primary nurse from each patient's care team. They were asked a series of questions pertaining to conflict. These questions were centered around the design definition of conflict, which was a dispute, disagreement, or difference of opinion related to the management of the patient involving more than one individual and requiring some decision or action. Based upon the responses to the questions, conflicts were able to be put into groups and classified by type. In some cases, conflicts were able to be classified by more than one type. The study took place in the PICU of Children's Hospital in Boston. It was conducted over an 11-month period and included 110 patients whose stay was greater than 8 days and the physicians and nurses on their care teams. Conflicts were identified by interviewing the physicians and the nurses. Of the 110 patients, nearly 50% experienced conflict involving their care. Of those, 60% were team-family and 38% were intra-team, and the remaining 1% was intra-family. The most common sources of conflict shown to be poor communication, which accounted for 48%. Second was unavailability of parents, which accounted for 39%, and disagreements associated with the care plan, which accounted for another 39%. So next, I'll give my personal critique of the study. Typically, conflict in the ICU occurs between clinicians and families with regard to end-of-life decisions. A strength of this study is that it showcases other conflicts and their sources. Also, it goes beyond focusing on the care of adults and focuses on the care of children. This opens the door for other conflicts to be explored. This study and its results provide a good foundation for resolving and preventing conflict in a pediatric ICU. Resolutions and preventative measures should be specific to the conflicts themselves. Knowing what occurs, why it occurs, and how often will aid significantly in this effort. A weakness of this study is that it only provides conflict from the perspectives of the physicians. Family members may have a different take on the conflict that occurred. Having perspectives from both parties would give better insight on the cause of the conflict. So next, I have a few discussion questions that I would like for you guys to consider answering. First, would you have altered the selection of the study participants? Would you have changed the controls? Do you think that they should have included other members of the care team? Why or why not? Second, how do you think the results would have been altered if the controls were adults instead of children? Third, were you surprised by the types of conflicts that were discovered and their sources? What are some types of conflicts and sources that you've seen in your facilities? And lastly, if you were to see these same results in your facility, how would you use these results to prevent conflict? What method or methods would you use? So, in conclusion, the study proved that conflict is common in healthcare facilities regarding the care of pediatric ICU patients with a prolonged stay. The majority of these conflicts occur between the care team and the patient's family members. The majority of these conflicts seem to occur as a result of poor communication, and this could significantly impact patient care. It is suggested that lower levels of education may play a role in poor communication being a source of conflict amongst team and family. This may lead to low levels of trust in providers and ultimately low levels of satisfaction with care. In efforts to mitigate the impacts of conflict, strategies such as ethics consultations and mediation have been proposed. This would increase the care team's ability to communicate information to the family, as well as increase the level of comprehension of the family when it comes to the medical care of the patient. And that concludes my presentation. I hope you guys enjoyed it, and please give your honest feedback and answer the discussion questions. Thank you.